Gentlemen, if you're over 60 and you feel like your energy just isn't what it used to be, if getting out of bed each morning has become a silent struggle, then get ready, because what you're about to hear will completely change your perspective on men's health. My name is Dr. Olivia Grant, and with over 20 years of clinical experience, I can tell you that the vast majority of American men in our generation are making 5 devastating mistakes with their intimate well-being. These are errors so common, so deeply ingrained, that most men don't even realize they are actively blocking their own vitality from the inside out. I'm not talking about complex issues that require invasive surgery. I'm talking about quiet, everyday habits you're probably engaging in right now that are profoundly sabotaging your health. Let me tell you about Robert, a 65-year-old retired factory worker from Cleveland who came into my office completely disheartened. He sat across from me with that look I've seen in so many of his peers, the look of a man who feels his best years are behind him. "Doc," he said, his voice cracking slightly. "For over 2 years, I've been waking up 5, sometimes 6 times a night to use the bathroom. My wife can't get a good night's sleep because of me, and I just feel like my body has betrayed me." I looked him straight in the eye and said something he never expected to hear. "Robert, your body hasn't betrayed you. You've been unintentionally abandoning your body." I explained that over the last few years he had fallen into a destructive pattern. He had completely given up any form of personal, intimate practice, convinced that at his age, it was no longer appropriate or necessary to care for that part of his well-being. "Every morning," I told him, "I want you to have a handful of pumpkin seeds with dried cranberries. And I want you to start reconnecting with your body in a conscious, healthy way." Robert looked at me as if I'd asked him to believe in a miracle. But 3 weeks later, my phone rang. It was Robert, and his voice was completely different. "Dr. Grant, I don't know how to explain it, but last night, I slept a full 8 hours for the first time in years. My energy is back. My wife is thrilled, and I feel like a new man." In the next few minutes, you are going to discover exactly what these critical errors are that are affecting millions of American men, why they are so detrimental to our health, and, most importantly, how a few simple adjustments can immediately begin to reverse the damage and restore the vitality you thought was lost forever. This isn't just about your intimate life or marital performance. This is about a medical truth that could be silently weakening your vital circulation throughout your entire body, leaving you feeling less connected to yourself, less energetic, and frankly, less whole as a man. The first devastating mistake that most men make after 60 is the unconscious intimate practice that leads directly to dysfunction. Allow me to share a medical truth I wish more American men felt they could discuss openly. Throughout my years in practice, I've had countless men in my office, hardworking, proud individuals who sit with their eyes downcast, their voices hushed by a quiet sense of shame. After we build trust and create a safe environment, I gently ask them about their self-stimulation habits. And almost invariably, the same thing happens. A moment of hesitation, followed by a painful confession. "Doc, yeah, I do, but I can barely feel anything anymore. I can only get there if I do it in one very specific mechanical way." The phrase that always hits me the hardest is when they say, "It's like my body has forgotten how to feel." What most of them don't understand is that their method of self-stimulation, fast, mechanical, disconnected from emotion, had been, without them realizing it, training their bodies for dysfunction. The consequences are silent, constant, and devastating to their overall well-being. This unconscious intimate practice isn't just a bad habit, it's a negative neurological feedback loop. Every time you perform it quickly, with tense muscles, eyes fixed on intense visual material, using the exact same method and seeking only a rapid release, you are teaching your brain that pleasure can only come from that precise routine. Unfortunately, the brain learns these patterns very quickly. What happens over time? Your sensitivity progressively diminishes. The quality of your intimate responses begins to deteriorate. You start needing more stimulation, more pressure, and increasingly intense methods just to experience what was once natural and spontaneous. It becomes progressively more difficult to respond adequately with a real partner. Many men end up avoiding marital intimacy because it feels too different, too slow, too authentic compared to their private habits.
And that's where the real decline begins. It doesn't just affect your body, it impacts your emotional well-being and your self-esteem as a man. I have watched men fall into spirals of frustration, shame, and even clinical depression. They become convinced their bodies are irreparably broken. But in many cases, their bodies aren't broken at all. They've simply been poorly conditioned through years of unconscious practice. This conditioning can lead to erectile dysfunction, delayed physiological release, or even a total inability to reach a natural climax. And these are not rare problems. In the U.S., it's estimated that over 30 million men suffer from some form of erectile dysfunction, and many cases are exacerbated by these very habits.
The tragic irony is that most men don't even realize they have unintentionally caused this situation. But here's the most important part, and I urge you to take this very seriously. When you condition your body this way without changing course, it's not just your intimate health that's at risk. Your personal confidence gradually erodes. You lose emotional connection with yourself. Your relationship with your own body grows cold. You start to avoid physical contact and flee from emotional closeness. For many American men, this feeling of disconnection opens the door to something much more serious: deep emotional detachment, clinical depression, and even early signs of cognitive decline. I've observed this pattern time and again in my practice. The cost is not confined to the bedroom. It affects you at your core. It changes how you walk into a room. It slowly alters the image you have of yourself in the mirror. You begin, slowly, to fade as a man.
My intention is not to create guilt, but to awaken you to a critical medical reality.
The good news is that your body has an incredible capacity to relearn and heal. Your nervous system can be restored, but this requires awareness, patience, and a new way of understanding personal, intimate practice. One that is slower, more mindful, more connected not just to physical sensation, but to the emotional dimension as well. Self-stimulation is not the enemy, but doing it unconsciously is like driving a car blindfolded. Sooner or later, you're going to crash, and when you finally notice the damage, fixing it could take much longer than you imagine.
Now, here comes a medical realization that many men completely overlook. While unconscious self-stimulation can cause significant harm, there is a practice that is even more dangerous, more common, and paradoxically, almost socially accepted in our culture. The second devastating error is the total abstinence from intimate well-being after the age of 60, something that could be weakening your health from the inside out
without you even perceiving it. If any of this is hitting close to home, do me a favor and hit that like button. It lets me know we're on the right track, and it helps other men find this crucial information. Your story matters, so feel free to share your thoughts in the comments below. You're not alone in this.
I vividly remember a patient I saw a few years ago. Let's call him Frank. He was 68, a dignified and reserved man, a veteran who preferred not to discuss personal matters. But he came to me because he was waking up 5, sometimes 6 times a night to urinate. He described a constant feeling of pressure, of fullness, even a dull, deep ache in his pelvic area, and he attributed it all to the natural process of aging. What he didn't expect was my direct question. Frank, when was the last time you experienced a natural release? He blinked at me as if I'd asked something completely out of line. Years, he replied with some discomfort. I haven't had any activity of any kind since my wife passed. And to be honest, Doc, I assumed that, at our age, men are supposed to leave that part of life completely behind. That response summarizes a mistaken but sadly common belief among American men of our generation, that once we pass 60 or 70, we are supposed to completely shut down our reproductive system. But here's what I explained to Frank and what I'm sharing with you now. When you stop experiencing natural releases, your prostate gland doesn't just stop working. It continues to produce prostatic fluid, and if that vital fluid isn't released regularly, it accumulates, creating a kind of stagnation within your reproductive system. That buildup is precisely what leads to prostatic congestion, inflammation, discomfort, and over time, real risks to your overall health. Your prostate is not biologically designed to store fluids indefinitely. When it fills up and isn't emptied, it naturally swells, becomes inflamed, and gets irritated. And that's when you start to experience frequent urinary urgency, a weak stream, constant dripping, and even pain during urination or natural physiological processes. The statistics are staggering. Benign prostatic hyperplasia, or BPH, affects about 50% of men in their 60s and up to 90% of men over 80 in the United States. Most men just accept it as an inevitable consequence of age. But the medical truth is that it's often a sign of a blocked bodily system, functioning under unnecessary pressure. And this is where the situation becomes truly concerning from a medical standpoint. Chronic inflammation of the prostate gland has been scientifically associated with an increased risk of developing prostate cancer. I am not suggesting that abstinence directly causes cancer, but I want to state this with absolute medical clarity. Experiencing regular, natural releases significantly helps reduce the inflammatory environment that can make the prostate more vulnerable to serious diseases. This isn't medical theory or speculation. A landmark study from Harvard University that followed nearly 30,000 men for several years definitively concluded that those who experienced natural releases at least 21 times a month had a significantly lower risk of developing prostate cancer compared to those who did not maintain this healthy practice. That's not speculation. It's solid, scientific evidence backed by rigorous research. But let's go back to Frank's case. After our medical conversation, after he fully understood what was really happening inside his reproductive system, he decided to make an important change to his personal wellness routine. He began to reconnect with his body, not out of romantic desire or loneliness, but for self-care, the medical and preventive reasons. Gradually, his symptoms improved remarkably. The pressure subsided. He was able to sleep better. And most strikingly for me as his physician, that spark of vitality returned to his eyes.
He reconnected with an essential part of himself he thought was gone forever. The cost of ignoring this medical reality isn't just a few bad nights. It involves chronic discomfort, reliance on unnecessary medications, potential future surgical interventions on the reproductive system, and yes, even a statistically higher risk of developing prostate cancer. All because of the mistaken belief that at your age, you should no longer attend to this vital part of your preventive wellness. You don't ignore your heart when you feel palpitations. You don't neglect your blood pressure when it's high. So don't neglect your prostate gland. It is equally important for your overall health and longevity. Now, I want you to reflect on this. What if I told you that the emotional shame many American men carry for decades, that silent guilt, that cultural taboo around personal contact, actually makes the physical symptoms significantly worse? Because that's exactly what you're about to discover in the next medical revelation. The third critical mistake men make after 60 is ignoring the fundamental medical principle of use it or lose it in relation to erectile function. There's a subtle lie that many men end up accepting after 60, and it sounds something like this. If I'm no longer in an active marital life, then I don't need to worry about natural erections. I've heard this justification countless times in my practice from hardworking American men who downplay or completely dismiss the importance of maintaining their erectile function because they genuinely believe they've moved past that stage of life.
But let me state a medical truth that many doctors fail to communicate with the necessary clarity. Erectile function is not exclusively about marital activity. It is deeply linked to your overall blood flow, your nerve health, your total cardiovascular integrity, and ultimately, your longevity and general quality of life. I remember the case of Alejandro, a 69-year-old man who came to my office. He was intelligent, with a life full of experiences and wisdom, but he had gone 5 or 6 years without experiencing a single natural erection. Not because his body was physiologically incapable, but because he felt he no longer had a medical or personal reason to maintain that function. His wife had passed away. He wasn't interested in new relationships, and he assumed that chapter of his physical well-being was definitively closed. What Alejandro didn't understand was that his body wasn't just patiently waiting for him to decide to reactivate those functions. His system was actively shutting down vital systems, progressively closing off functions. And here is what most American men don't fully comprehend from a medical standpoint. The male reproductive organ, just like any other muscle and vascular structure in the body, strictly adheres to the biological principle of use it or lose it. If you don't regularly stimulate the vascular system of the reproductive area, the tissues gradually lose their elasticity. The blood vessels become less flexible and efficient. The oxygen flow to the tissues significantly decreases. Microtears and fibrosis, that is, the pathological hardening of normally soft and flexible tissue, begin to form. Over time, even if the desire or opportunity returns, the body can no longer respond physiologically as it once did. And this is not due to chronological age. It is due exclusively to the lack of use and maintenance of the vascular system. And that's where the real medical cost appears. And believe me, it is extremely high. When natural erections cease to occur regularly, the smooth muscle of the reproductive system begins to progressively atrophy. The complex network of blood vessels that allows for erections becomes increasingly inefficient. Nitric oxide, a chemical substance absolutely essential for achieving healthy erections, drastically decreases in the body. And here is the medical detail that almost no health professional clearly mentions to their patients. This process of deterioration occurs inevitably even if you are not trying to have marital activity. It is an immutable biological law. If your body does not experience arousal and erections on a regular and consistent basis, it automatically interprets that this system is no longer necessary for survival. Over time, the damage is not only physical, it also becomes profoundly psychological and emotional. As the body progressively loses its ability to respond, the mind inevitably follows the same pattern. Personal confidence weakens, self-esteem crumbles, and you feel increasingly disconnected from your fundamental masculine identity, not because of chronological age, but because your body no longer responds to the identity you once proudly represented. In many American men, this leads directly to social isolation, deep sadness, and even early signs of cognitive decline, and I have observed this repeatedly in my medical practice. It doesn't happen abruptly or dramatically. It's a slow, silent, and completely avoidable process with the right knowledge and practices. So, what can you do to prevent this deterioration? You can consciously and intentionally remind your body that this system is still important, that this function is still essential for your overall well-being. And you can do this without a partner, without social pressure, without cultural shame. Maintaining regular erections, whether through conscious personal contact or even with stimulation not necessarily aimed at pleasure, keeps the vital blood flow active, oxygenates the reproductive tissues, and preserves essential neural pathways. It's not about seeking pleasure for pleasure's sake. It's about protecting a fundamental aspect of your physical health and your identity as an American man. Sustaining erectile function is not just a matter of intimate life. It is a powerful way of communicating to your body, I'm still here. I'm still connected to myself. I am still completely alive. And believe me, I understand perfectly how easy it is to retreat in silence, especially when our society seems to tell you that after a certain age, you should just quiet down and resign yourself to decline. The fourth devastating error you need to know about is how certain modern visual habits are literally rewiring your brain. But the good news is, you can regain total control. By the way, if you're finding this information valuable and want to make sure you don't miss our future deep dives into men's health, take a second to subscribe to the channel. It's a simple click that keeps you in the loop. I want to address a topic that is rarely discussed openly, especially among American men of our generation: the consumption of intimate visual material. I know that just mentioning this topic can create discomfort. You might want to switch videos or look away, but if you're still here with me, I ask you to listen with an open mind, because what I'm about to reveal could completely transform your understanding of your mind, your body, and your own masculinity. I have treated American men in their 60s and 70s who have sat in my office and, with complete honesty, confessed that they still consume intimate visual material. They don't do it out of obsession or vice, but because they feel it's one of the few avenues left that allows them to experience some kind of stimulation. Many live alone. Some are divorced, others are widowed. And they aren't looking for cheap gratification. Deep down, they are searching for connection, or at least the echo of what was once a real connection with their own vitality. But here is the critical medical point that almost none of them fully understand. The type of intimate visual material available today is nothing like what you knew in your youth. What were once static images or relatively mild visual stimuli have now become a torrent of fast-paced, hypersensory content, specifically designed to create instant gratification. And the human brain, especially one that is naturally aging, is not biologically designed to process this intense level of stimulation without significant neurochemical consequences.
Every time you consume intimate visual material, especially the more intense or fast-paced kind, your brain releases dopamine, a chemical directly related to motivation, pleasure, and the reward system. But over time, through constant repetition, your brain develops a tolerance and becomes progressively desensitized to natural, authentic stimuli. Real contact, genuine sensations, begin to feel insufficient compared to the artificial intensity. You require progressively more intensity, more novelty, just to experience something remotely similar to pleasure. And this is not a matter of personal preference. It is a profound and measurable alteration in your fundamental neurochemistry. Your brain is literally being rewired. And when it gets used to anticipating artificial and exaggerated stimulation, your body also changes accordingly. Erections become less reliable and consistent. The natural process of release becomes harder to achieve. And in many cases, what is medically known as visual material-induced erectile dysfunction appears, a state where a man can only respond intimately if artificial visual stimulation is present, but is completely unable to do so with a real partner, or even during moments of personal intimacy without that external stimulus. The consequences extend far beyond the intimate sphere. I have watched American men fall into spirals of deep shame, chronic anxiety, and constant frustration. They begin to sincerely believe they are irreparably damaged. They withdraw socially, resign themselves emotionally, and most tragically, they never make the causal connection. They never realize that the very thing they turned to for relief and connection was what was slowly robbing them of their natural, authentic vitality. But here is the most important message I want to communicate to you with absolute clarity. This is not irreversible. You are not permanently damaged. Your brain, even after 60, still possesses the neurological capacity to heal, to reset, to rediscover what genuine, natural, and authentic arousal feels like. And that process of neurological recovery begins precisely when you make the conscious decision to step away from artificial stimuli and allow your body to reconnect with reality, with presence, with authentic sensations, with your own imagination, and yes, even with quiet moments of self-exploration without rush or pressure. Some men opt for a complete 30-day break from any type of artificial visual stimulation. Others do it more gradually and structured. It doesn't matter the speed of the process. What matters fundamentally is starting the journey of rebuilding the relationship between your nervous system and pleasure on your own terms, without external dependencies. The goal is not to renounce pleasure. It is to reclaim it completely, to make it genuinely yours, to feel something authentic and real. The fifth critical error I want to address is the cultural shame surrounding personal contact and how it profoundly affects your mental and physical well-being. There's a very particular kind of silence I frequently observe in American men of our generation. It's a silence not expressed in words but in subtle, revealing gestures. The way they avert their gaze when I ask about their intimate well-being, how they slightly hunch over when I mention the importance of self-care, how they dismiss it with a nervous laugh, change the subject, or say, "Doc, that's not for me anymore. That was for my younger years." But I clearly perceive what isn't being verbalized. It's not that they've stopped needing personal contact by their own choice. It's that somewhere along the way, our American society taught them that it was no longer appropriate, dignified, or necessary to care for that essential part of their well-being. And let me state this with total medical clarity. This type of silent, culturally imposed shame is one of the most destructive forces to your overall health today.
For decades, many of you grew up in an era and culture where personal contact was considered sinful, inappropriate, or a sign of moral weakness. You may have received punishment, ridicule, or deep humiliation related to your natural sexuality. And those negative messages never completely disappeared from your psyche. They simply sank to the bottom of your consciousness, lodged themselves in your nervous system, and silently shaped the relationship you have with yourself, even today. The result is a gradual, constant withdrawal. You begin to disconnect from personal physical contact, even if you deeply crave it. You start to perceive natural desire as something inappropriate for your age. You stop touching yourself, not because you genuinely don't want to, but because you have been culturally conditioned to believe you shouldn't. And over time, that disconnection isn't just emotional. It becomes biologically real and measurable. Because what many American men don't know is that healthy, regular, intimate contact, including conscious self-stimulation, provides real, scientifically measurable support for your overall mental health. It regulates cortisol, the chronic stress hormone. It increases dopamine, related to motivation and natural pleasure. It stimulates oxytocin, the hormone of emotional bonding, connection, and personal trust. It even significantly improves sleep quality, stabilizes mood, and keeps cognitive function active. But cultural shame completely interrupts all these physiological benefits. Shame chronically contracts your muscles, elevates your stress hormones in a sustained way, and creates cycles of guilt so old and ingrained that you no longer even perceive them consciously. And shame itself is a powerful and constant psychological stressor. Chronic stress has been scientifically linked directly to anxiety, depression, cardiovascular diseases, immune system dysfunction, and even the development of premature dementia. I remember a 72-year-old patient, recently divorced and deeply depressed. He wasn't on psychiatric medication, had no serious diagnosed illnesses, but he was completely exhausted, emotionally numb, and socially isolated. He confessed to me that he had gone more than a decade without any kind of intimate activity, neither with a partner nor alone. I just assumed that chapter of my life was definitively closed, he explained. And behind his words was a very deep and silent sadness. Not for the lack of intimate activity itself, but for having voluntarily lost an essential part of himself. We worked together patiently, without medication, without drastic interventions, only with gentle, gradual exercises specifically designed to help him reconnect with his body without cultural guilt, without performance expectations. And after a few weeks, something fundamental changed in him. He started walking taller, sleeping more deeply. His genuine laugh returned. Even his blood pressure stabilized naturally. He wasn't fixed. He was reconnected with himself. And that is precisely what cultural shame steals from you. Your natural vitality. Your fundamental joy of being alive, little by little, without you consciously perceiving it. Shame deceives you, makes you believe you are too old to feel whole and complete. But that is completely false. You are never too old to touch yourself with tenderness, dignity, and healthy intention. You are never too old to feel complete as a man. Now, I want to address the most dangerous error of all, more destructive than any isolated physical problem. The deep isolation from yourselves. Among all the risks that American men of our generation face, there is one that stands out as the most devastating, more damaging than declining testosterone, more destructive than any visual habit,
more insidious than any specific physical symptom. Profound emotional and physical isolation. And I'm not just talking about living alone or not having a partner. I'm talking about a deeper, more indivisible silence. It's the state where you are no longer touched by anyone. You no longer touch yourself. You no longer genuinely connect with your own body as something valuable and worthy of care. The U.S. Surgeon General has declared loneliness a public health epidemic, and studies show that older men are particularly at risk, with social isolation increasing the risk of premature death by over 25%.
This doesn't happen because of a conscious, deliberate decision. It happens because, gradually, our society has taught you that men your age should completely leave behind that essential and vital part of the human experience.
I remember a patient named Ernesto, a 76-year-old retired engineer, courteous and seemingly serene on the outside. But in his voice, there was a kind of emotional void as he described his daily routine. He confessed that he had gone more than a year without receiving any kind of human physical contact. Not a hug, not a friendly hand on the shoulder. Absolutely nothing. "Doc," he told me, "I don't even remember what it feels like to be touched by another person." And here's something almost no one dares to express openly. Physical and emotional isolation often begins in the most intimate and personal space. Your relationship with your own body. When a man completely stops touching himself, not just for pleasure but to reconnect with himself, his brain automatically interprets that lack of contact as a signal of emotional withdrawal and personal abandonment. Over time, that withdrawal becomes a devastating, vicious cycle.
You touch yourself less, you feel less, and you gradually convince yourself that there's nothing left to feel or experience. That is the true cost of isolation. It's not just the loss of physical functions or desire. It's the slow but constant disappearance of your identity, your purpose, your fundamental emotional sensitivity. It's the silent death of the connection with yourself. And this type of deep isolation has been scientifically linked directly to clinical depression, cardiovascular diseases, and even premature death. Not because of chronological age, but because of emotional abandonment. Not by others, but by you, to yourself.
Now, I want to establish something with absolute clarity. This is not about blame, reproaches, or additional shame. Life changes. Inevitable losses happen. Emotional distances can appear due to circumstances beyond your control. But what does not have to happen, what is completely avoidable, is total surrender. Because the conscious act of touching yourself, whether with intimate or simply therapeutic intention, is not about personal vanity or outdated customs. It is about actively reclaiming your body as something that belongs to you. About sending a clear and powerful message to your brain, your heart, your entire nervous system. I am still here, present. I still have value. I still want to feel completely alive. I have watched American men regain extraordinary vitality simply by giving themselves the conscious permission to reconnect, to break the self-imposed silence, to return to personal contact, to reactivate parts of themselves they had shut down far too prematurely.
And when they do it consciously, their physical posture changes noticeably. Their voice regains strength and confidence. That inner spark, that fundamental vitality, begins to shine in their eyes again.
Gentlemen, if you have come this far with me, If any of this medical information has resonated deeply with your personal experience, then what comes next could be the most transformative part of our entire conversation. Because now that you know these fundamental medical truths that no one has ever clearly explained to you, I am going to share the exact protocol I use with my own patients. A simple, yet extraordinarily powerful daily routine specifically designed to reconnect your body, restore your natural sensitivity, and give back to your system everything that the passage of time and the weight of cultural silence have tried to take away. And I want you to know that Robert, the man I told you about at the beginning, didn't just regain his energy and his ability to sleep through the night. 6 months after implementing these changes, he contacted me to tell me he was taking his wife on a second honeymoon. Your health is your greatest asset. It's time to take back control. If you don't want to miss that protocol, make sure you're subscribed and hit that notification bell so you're the first to know when it drops. See a doctor, start the conversation, and I'll see you in the next video.